Hello, I'm Chelesa Presley, and I am the co-founder and executive director of the Diaper Bank of the Delta, located in Clarksdale, Mississippi.
And you started this organization.
Yes, I co-founded as a community project when I was working for another nonprofit in the community, and I saw the need that parents really needed diapers, and there wasn't another program in the area or the state that was addressing that need. There were programs that was addressing food insecurity, such as WIC, and other basic needs such as SNAP and TANF, but there was no federal or state funding safety nets that provided diapers for families.
And that's one of the things families would probably do without because they wouldn't. Food comes first.
That is true.
Yet there's a big need for the diapers.
So that is what families were doing. They were kind of neglecting that for their children, and you will see children having diapers on longer than they should, which cause health issues both for the child and for the parent, because what it does for the parents, which a lot of people overlook, is cause maternal stress. Because think about it, if you have a crying baby all the time, your stress level goes up.
I bet.
Yes, and even for the father, paternal stress. And for the babies, there were higher incidences of diaper rash and UTIs and things that actually lead to long-term health issues that a lot of people did not even realize into adulthood.
And so, what year did you start this?
So this project came about in 2016. It started, as I stated earlier, in 2015. I was working for another nonprofit, and I had been working with them for 10 years, and we were having community meetings with stakeholders in the community dealing with maternal child health. And at this meeting in March of 2015, the grant had changed, and I said, you know what, I've been coming, we've been talking, and for 10 years we have not done anything to help bring about systemic change in this community. So no longer do you need to come to my meeting, eat my food, and suck up ideas, and no longer and come and don't help the families in your community. So I closed my computer, my PowerPoint, and I said, we're going to brainstorm some ideas where families can see that we're actually trying to change the needle around there.
And so, you help people all over the state of Mississippi?
Yes. So we cover the whole state of Mississippi and the Delta region of Arkansas and Louisiana. We're on the Clarksdale is located on the Mississippi River. The Arkansas-Mississippi Bridge is 25 minutes away from Clarksdale. So we cross over the bridge and cover the lower Delta region in Arkansas and the Delta region across the river in Louisiana. There's not a diaper bank or coverage area in those areas. We share some of the same data. We're poor on both sides, and our people are having the same struggles.
And so, there are elderly who are also poor and are incontinent. Do you provide diapers for them, or depends, that type of thing?
So yes, we are getting more into providing those type products. That wasn't our focus at first, but because diapers, we started receiving a lot of them from when families transition. Families were donating them to us, so we started carrying the pull-ups, the diapers, the pads, and the bed pads.
Okay. So, I mean, I don't know that much about babies, but I know they probably go through quite a lot in a day.
Yes, so the average person doesn't know that the average baby use 8 to 12 diapers a day.
Oh my God.
And when you think about that, and then you look at the cost of diapers, to properly diaper a child, you should change their diaper every time they urinate. Not when the diaper get full. I always tell families, think about yourself. If you urinate on yourself, what you gonna do?
Mm-hmm.
You're gonna change yourself, right? The same for our children, because when that is a waste product coming out of our bodies, and it is full of acid and other types of material that is not supposed to be near our bodies. So when you leave it on the child, it starts eating at their skin.
Oh my.
And that caused the child to be agitated, and it causes rashes and other things that can happen, because this is waste, and what waste, you should remove waste.
So when the mom or parents come to you, like, how many do you give them at a time?
So there's been a national study, and I'm also a part of the National Diaper Bank Network, which I sit on the board. And from this study, it has shown that families need about 50 diapers a month to help fill that gap. So we're trying to fill a gap.
Right.
and it takes about 50 diapers a month.
Ever added up how many you go through in a year?
So this past year, 2023, we gave out close to 1 million diapers.
1 million? Do you have like a I know you don't store them all one time, but do you have a huge warehouse or?
So we have a partnership with a local community agency in our community, which is the Mississippi Farmers Association, which has our local emergency management warehouse, and they have a 55,000 square feet, and they allow us to use their facility to receive and store some of our pallets when we cannot.
So I'm assuming you have to mail these to some people.
Yes, we do.
Okay.
We provide services 4 ways, and the first way is direct service. We have a storefront building in Clarksdale, Mississippi, which is our flagship where we started. We have a depot which is in Quitman County, Marks, Mississippi, which we operate that depot at a local church every first and third Wednesday of each month from 11 to 2. And then the second way we provide diapers is through partners. We have partners throughout the state of Mississippi who are already serving these families, and they order diapers from us, and we provide those diapers to them, and they serve their communities. The third way is through community distributions. So I drive, and you're here with me, but a truck like that, and I pull a 6x12 trailer that is fully loaded with everything. We pack in and we pack out, and we go to communities and we set up, bring in diapers, wipes, menstrual products, baby supplies, formula, and we give out to anyone who can come to that location, and without any charge. And communities invite us there. The only thing we ask the whoever invite us is for a donation for travel, because gas is expensive. Mm-hmm. The fourth and final way that we make sure that people throughout the state receive these diapers is through the mail. For those that cannot access us through those other 3 ways, we do mail these diapers to them, and families can access our diapers every month.
Okay.
So they can get them as long as their children are in diapers.
And you told me most states have some sort of diaper depot like this, or diaper bank.
Yes.
But if people wanted to give to yours, because we know Mississippi isn't high up as economic status as some states, and you could probably use help. I'm going to leave the website below, and they could contact through that, and there would be a link or something.
You can donate through Cash App, PayPal, Venmo, Giveify, or you can mail us a check to our P.O. Box, P.O. Box 252, Clarksdale, Mississippi, 38614. Or you can call us. We take product donation. If you don't want to just donate through the mail, we can donate through Amazon, our wish list. We do take products also. And we need all diaper sizes, including pull-ups and adult inconstant products.
And how many people and volunteers or staff, paid staff, do you have working for you?
Paid staff is 2, and everybody's part-time. And volunteers, we average about 100 to 150 volunteers a year.
So how big is Clarksdale, Mississippi?
Clarksdale, Mississippi has 14,000 people.
So small city.
It is.
Way bigger than where I live. Well, Chelesa, your last name's Presley. Any relation to Elvis?
Well, my father-in-law says all Presleys are kin.
All right. All right. State of the blues and birthplace of Elvis.
Yes, can't beat it.
And good people like you. So,
and good food.
And good food. So I'm going to list all these links and info in the notes below the video. Check them out. Please support them if you can. Thank you so much.
You're welcome. Thank you.